Hello everybody, thank you for joining our session today on World Without Skin Tears Day. I'm very excited to be presenting with my co-hosts Vijay, Kimberly, Anika, Emmy, Ray on the financial burden of skin tears, a health economic perspective. And this is so interesting because this is the first time really we've been able to get a good health economic perspective relating to skin tears. So I do hope that you enjoyed the session and the questions. So by the end of this presentation, you should be able to describe the clinical and economic burden of skin tears in the healthcare system. And we want that to include both direct and indirect costs. Some of these are sometimes forgotten, so we're going to highlight them for you. We want to compare the clinical effectiveness of soft silicone dressings versus non-silicone dressings in promoting skin tear healing. And we've looked at the health economic modelling over a 3-week period. And we want to discuss the implications of health economic modelling for clinical practice, policy development and healthcare resource allocation. And this is really important because we talk a lot about which is the correct dressing, when should we be doing it, but we often don't have that health economic understanding behind why we do what we do. So through this presentation, which will be myself and Vijay, we'll then go into a question and answer session with the experts to be able to dig further down into what we want you to understand. So of course we have to start off with what are skin tears. And often people think, oh, they're just a little bit of a cut on a leg or an arm. But we know that they can be far more severe than that. It can be quite painful as well. And they tend to get in the way as well if you want to put a pair of socks on, or they can rub against trousers. So it's important that we know what they are. And you'll see that ISTAP, particularly with Kim, have developed some definitions here that we should all be using. So a skin tear is a traumatic wound. And remember, it's classed as an acute wound as well. So we do expect them to heal within 14 days. And it's normally caused by mechanical forces. So somebody may have banged the leg against something, they may have fallen over, but also it can be because of removal of really strong adhesives that we put onto fragile skin sometimes. We come to take that wound dressing off or that piece of tape and we tear the skin at the same time. The severity varies by depth, and if you look on the ISTAP website and look at our consensus documents, you can see that there is a system there to look at if it's a type 1, type 2 or type 3. But what we say is that the severity may vary by depth, but will not extend through the subcutaneous layer. And we also need to think, as you can see in this image, there's quite clearly a skin flap there. And we define that as a portion of the skin that is unintentionally separated from its original place due to that sheer friction or blunt force trauma. So we shouldn't confuse this concept with tissue that's intentionally detached from its place of origin, such as in skin grafting. So even though we often think it's only a skin tear, remember these are really quite complex skin integrity issues. So as I've just said, they should heal between 14 to 21 days. And unfortunately, sometimes we see that they last a lot longer and then turn into what we define as a chronic non-healing wound. So we need to ensure that all potential factors which could delay that wound healing, and I'm sure you already know about these, but diabetes, peripheral vascular disease, peripheral edema have been addressed as well. And also looking at that skin frailty. So, and it's not only older people over 65 that are at risk of skin tears, anybody is at risk. But when we look at the World Health Organization or we look at places like the Office for National Statistics, we can see there is generally a rise in the aging population. And alongside that, there's also a rise in comorbidities. So we can generally assume that demand for skincare among older adults is expected to increase significantly. And similarly, in line with that, we know that the cost is significant when we talk about skin tears. And if we don't manage them adequately and effectively, then the patient is at risk of an infection, prolonged hospital stays, and of course, a reduced quality of life, which is not what we're aiming for. We're aiming for these wounds to heal within the normal 14 to 21 days, not reduce quality of life, and not inflict pain on the patient as well by putting dressings on that stick to this already fragile skin, and we're then at risk of more skin tears. So I'm going to hand over to Vijay, and he's going to talk to you about how he undertook the health economics, what we base this on, and what the results are as well before we go into the discussion. Vijay, I'll hand over to you.
Thank you, Karen. Yeah, it's Karen mentioned. So this is the first time we are doing the health economic evaluation of skin tear management. So in this study, we use the health economic modeling based on previously conducted randomized control trial that evaluated the use of silicone dressing for the treatment of skin tears. So we took the effectiveness data from this clinical trial and then use a decision model to estimate the long-term cost of skin tears. So for this one, we use the decision analytic modeling framework, and we use in particular the decision tree model, where we synthesize data from the clinical trial and the literature from other published sources and estimated the cost effectiveness of healing skin tears with silicone dressings compared with non-silicone dressing over a period of 3 weeks. So that is the period, 3-week period, which we had evidence from the randomized control trial. And we use the healthcare perspective in terms of estimating the cost. And the outcome data from the clinical study, from that clinical trial, it suggested a higher healing rate of silicone dressing, which is almost 97% healing rate, compared to a non-silicone dressing, which is 34%. And we conducted the sensitivity analysis around these estimates and tested the impact of assumptions, which we incorporated into our economic analysis. So in a simple term, like this is the decision tree which we have used. So this figure here you will see is it depicts the patient pathway, so which are in the branches, so with a series of logically ordered alternative events. So this is what we observe, what it was done in the clinical trial. At first, so we allocate the patients to either the silicone intervention arm or the control arm, which is the non-silicone dressing. Then we observe the healing rate in every week for 3-week period. And the model, it explored the decision to use whether the new dressing or the old non-silicone dressing over this period. And at the end of each decision point, so the patient was deemed to have either a complete healing or an unhealed wound. And the proportion of patients in each outcome category, whether they are healed or unhealed, so it was estimated, it was based on the definition of the ISTAP skin tear classification, which was used in the clinical trial. And the one thing we assumed here is the same healing rate, healing time for those who receive a specialist care, for those who did not heal at the end of 3-week period. So here we summarize the cost and effectiveness results. So as we can see here from these two arms, the silicone and non-silicone arms, so the skin tear management for over a 3-week period, we can see the new treatment, which is the silicone dressing. So it was more cost effective. It is cost saving. We saved 4,558 pound cost. So we can see here, although the cost of the silicone dressing arm was 293 lower, but there's a higher cost in the non-silicone dressing. And so this is mainly driven by the higher healing rate in the silicone dressing group. So when we talk about the intervention cost, cost of these two technologies, so it is around 13 pounds per week for the silicone dressing versus 4 pounds for the non-silicone dressing per week. So this is a tornado diagram where we tested the sensitivity of those parameters which we use to populate the decision tree. And the two things that I would like to highlight here is the most sensitive parameters in our cost effectiveness estimates are the cost of managing unhealed wound, so which is the wound that is unhealed at the end of week 3, and the probability of healing wounds. However, these results were not sensitive to dressing consumables and the nursing time. So in conclusion, the use of silicone dressing for healing skin tears in this population, in this elderly population, compared with standard care, that i.e. without silicone dressing. So it not only improves the clinical outcome that we observe in the clinical trial, but it also costs less overall, and which is leading to overall cost saving. So this is study which serves as a guide for evaluating other technologies or other interventions in this clinical area, and thereby generating more evidence on the cost effectiveness, which will ultimately help inform decision makers in assessing the economic aspects of skin tear therapies. Thank you. Over to you, Karen.
Thank you, Vijay. I find this absolutely fascinating and also a little bit worrying that we've never done any real health economic data before. And Kim, yours and Kevin's paper was actually the only one we could find to be able to model against this. So it does show that there is a huge gap in the evidence when we look at health economics and different types of wounds. But Kim, can I ask you, because you are the skin tear queen, I hate to say, but do you think that skin tears are recognised as a financial burden compared to other wounds like your pressure injuries and pressure ulcers?
Sadly, no. And, I really can't thank Vijay enough for all of his hard work in doing this modeling for us because we're so desperate to have this work done. As you said, the paper that Dr. Wu and I did is the only one that we could find. And unfortunately, even now, yesterday I was rounding in an aged care home and I was told, well, it's just a skin tear, but it's been there for 3 months. Can you have a look at it? So I don't think people are appreciating how complex these wounds can become. Yes, they are acute wounds that should heal in a timely fashion if managed appropriately. Sadly, they're often mismanaged. Comorbidities such as edema are not controlled for. And so they become chronic and complex, and then they become very costly. If you have someone who has a skin tear on the lower leg, and you don't deal with the comorbidity of edema, you don't put them into the proper dressings, that wound can cost you thousands and thousands of Canadian dollars to manage. So unfortunately, it's been 12 years that we've been saying they're not just skin tears. And I'm still hearing, well, it's just a skin tear, meaning people are minimizing them and they're not appreciating the severity of them.
I think it's a really good point, Kim, because we hear it nearly every day, don't we? It's just a skin tear because people think of it as more like a paper cut. That's what a skin tear is. So it's just a little bit of a slice of your skin that's disappeared. It's not until they see what can be really quite huge wounds, especially if it's a type 3, when all the skin's gone. So I think this health economic modelling is going to help because people often look at cost, don't they? And they think rather than looking at cost per unit, people might start thinking exactly what you said, that if we don't manage them appropriately, we're going to have leg ulcers, infected wounds.
Yeah.
Thank you, Kim. Ray, could I ask you, do you think, we always say prevention is better than cure, and we talk a lot about whose responsibility it is to prevent and manage, but whose role do you think it is to prevent and manage skin tears? Or is it nobody's role?
Thank you for the question, Karen. Very good question. I think fundamentally it's everyone's role, but I'll start with people that are in the business providing care, be they healthcare professionals or social care professionals. I think of a primary responsibility in two main ways. So one is in terms of the actual practical physical care that we give to people. And secondly, I think it's also in terms of health promotion. And I think there's a bit of an irony as well that skin is the largest organ in the body, but also it gets the least attention. So I think there's something to be done around healthcare promotion and informing the people that we look after and the people in our communities and populations about how to look after their skin appropriately, moisturizing, making sure they avoid sharp edges, and making sure that people have other important things like good nutrition, but also for those who have limited mobility or quite frail, making sure that if we're repositioning them or if they're moving, or supporting them to move or go about the activities of daily living, we're taking measures to protect their skin. So I think in terms of giving people advice about how to look after their skin better, that's really important. Then also the other part of that is how you actually deliver care. And as Kim was alluding to, I think it's about recognizing a skin tear for what it is and implementing the care when we need it. And given the focus of our talk today, it's also about thinking very carefully about the type of treatment that we provide and making sure that we provide the best possible treatment at the beginning. Unfortunately, sometimes skin tears do happen, but if they do happen, it's making sure we're in a position to give people the best possible care. I also think for the public, and for carers and for family members, they also have a role to play because they often spend more time with people who are vulnerable, and people at high risk of skin tears. So I think it's everyone's responsibility. But healthcare professionals have a key role to play in that part in terms of educating the people that we look after in the wider population, but also in terms of practical care that we deliver to people at risk of or living with skin tears.
Ray, thank you. And while I was listening to you then, and you were talking about moisturizing skin as well, I don't know if the rest of the panel agrees, but I think healthcare professionals have in the past been quite reactive. So they react very swiftly to it if they see a skin tear or a pressure injury. But we don't always, and we talk about prevention, but we don't seem to get that much funding in for prevention sometimes because it's very hard to quantify, to pay for all this equipment first and then to say, well, we've reduced skin tears by 30% because we've padded up all table sides, for example. So it's quite difficult, isn't it? We can sit here and talk about the importance of prevention as well. But for some clinical practitioners, it's quite difficult to get that equipment in to prevent because you can't quantify it.
Yeah, I couldn't agree more, Karen. When you're talking about the prevention piece, it is very, very difficult. Back in 2014, Dr. Carville and her team did a fabulous study looking at moisturizing, and they showed that they were able to reduce their incidence per 100,000 beds by almost 50% by twice daily moisturizing, which sounds great. But one of the issues is when you try to translate that into practice, first of all, there's no real clear guidance on which moisturizer to use, how to use it, and caregiver time. Some of the biggest impact we've had is when we can get caregivers to do it in the home care setting. We do have better success there, but it is very difficult to quantify.
Yeah, it's so sad, really, isn't it, that everything does seem to come down to cost rather than looking at some outcomes. So after we've just chatted about prevention and find it very hard to quantify the cost associated with preventative measures, Ray, I've just thought of this question, that do you think cost should actually influence the dressing we choose?
The answer is yes, but perhaps not. But perhaps not in the way that most people would imagine. So I think cost is important, but in terms of value for money, and sometimes people, I think, go down a bit of a rabbit hole. People get confused because they focus on the headline price of what something costs, what the dressing costs. For me, it's about value for money. And I'll expand that in a bit more detail. So often you might be able to secure a cheaper dressing, but it will result in a longer healing time. So it will take longer for the skin tear to heal. Whereas the more expensive dressing might promote healing of the skin tear more quickly. So in my sense, cost is important, but it's also about value for money. And I know that sounds counterintuitive, but it's really important. And I'd encourage people to think of it in this way, that if someone has a skin tear, then that takes longer to heal. During that period of time, they're probably going to experience more pain. It might also impact on the activities of daily living. if there's someone who's working or has caring responsibilities, their ability to do those things will be limited. And those are additional costs that we don't always take into account when you go about our work. So I think cost is important, but it's about putting it in the context of what's value for money, what's actually going to help the patient, and what's going to promote to enable them to recover fairly quickly. But Kim, I don't know if you have different thoughts around cost and value for money.
I couldn't agree more in terms of we need to find the right dressing for the right patient at the right time. And that doesn't always mean the cheapest dressing. I think as clinicians, part of our job has to be fiscally responsible. So I think we need to find the most cost-effective method for closing a wound, either preventing or managing a wound. And while, yes, cost of products will come into it, so if we have two similar products and both will do the same, have the same outcomes at the same time, then we should choose the more cost-effective product. But part of that, is, I think you so eloquently said, Ray, is that the least expensive product isn't necessarily the most cost-effective product. So it's really all about finding the right product for the right patient at the right time. And the reason that Dr. Wu and I did that study back in 2022 was because we looked at it and said, we're seeing wounds healing faster with the more expensive silicone dressings than other traditional types of dressings that were being used. So we moved to the silicone dressings, and we found that our wounds were healing, were closing 50% faster, that the healing rates were higher, but we still didn't have the financial piece. So this is where we're so happy that Vijay was able to spin the economic piece for us so we could actually show the economic outcome.
I just wanted
Thank
to
you.
add that
Sorry, Ray, go on.
I just want to add a different dimension, I think, in terms of cost as well. So the question that Karen asked was about the cost of the dressing, which is really important for fairly obvious reasons. But the other dimension here is the cost of staff time. So if you have a cheaper dressing that you have to replace more often, there's the added cost of staff time. And that's something that people don't always think of. But if you've got a better dressing that's perhaps more expensive as a headline price, but you don't have to change this often, actually that results in changes. So that results in savings over time. So I think it's also taking into account the cost of staff time alongside the cost of the actual dressing when you're thinking about cost effectiveness as well.
Ray, thank you. And Ray, I want to bring Vijay in here. Vijay, as a health economist who obviously loves skin tears now after you've done all this work on it, when you're thinking about doing the modelling, not just for skin tears, but for any sort of modelling, what does value for money look like in the context of your health economics modelling?
Yeah, thank you, Karen. Thank you for bringing me in this clinical area, which was new to me before. And I totally agree with Kim and Ray. I mean, what they mentioned about the resource use. So in the context of skin tear management, the value for money is not just about finding the cheapest product or the treatment. So it is all about the optimal balance of clinical effectiveness, for example, wound healing, quality of life, and cost. So it goes beyond the finding the lowest price of the product to include long-term cost and outcomes. So it's the long-term cost and consequences. So as a decision maker or a healthcare manager, so we'd always like to minimize the cost of resource use and maximize the health outcomes so that the more people will benefit with spending less money. And ensuring that the new technology or the new product, it processes and it achieves the desirable clinical outcome. So in our analysis, and as Ray and Kim alluded, so it shows that the cheapest product is not always cost effective, although the non-silicone the dressing was like almost 1/3 cheap. But if a skin tear is mismanaged or if it is left unhealed, then the cost escalates exponentially because of the infection, the pain management, and all the complexities. And these even require substantial nursing time for assessment and other paperwork. So one thing I would like to mention here is in our analysis, we only looked at the healthcare costs. However, when other indirect costs, such as productivity loss, patient and families' out-of-pocket expenditures, and the cost and benefit to the other sector, for example, social care services, when they are taken into consideration, then it will have significant cost saving. As people used to say, the cheapest skin tear is the one that never happens. So the skin tears are often preventable if they are prone to complications in the aging population as the population is aging more rapidly. So in the long-term context, so the value, it looks like in terms of investing in prevention, such as increasing awareness of skin and integrity, rather than just focusing on treatment supplies. So these public health interventions, so they have huge potentials, so i.e. likely more return on investment. So as Ray and Kim said, in the context of skin tear management, so the primary cost drivers, so they are based, which are based on the current evidence we have. They include the nursing time, dressing, consumables, and the clinical procedures. But as the healthcare system, it transitions from analog to the digital, and there is also the potential to enhance clinical assessment by leveraging emerging technologies, such as the use of AI in early identification and the risk assessment, so which will have huge impact on economic costs.
Vijay, you've said such a lot there in such a short period of time that's really interesting, particularly bringing in the AI elements as well, because we're going to see more and more of AI coming in there. But I think some of the issues are that we've got healthcare, we've got social care, we've got care homes, we've got loads of different areas where people are cared for. But because the funding is quite different, then that then causes issues for people to be able to manage these skin tears or any sort of wound in a value for money way as well. But Vijay, as a health economist, and you've worked with us really closely now as well, do you think that all healthcare professionals, nurses, doctors, podiatrists, physios, whoever it may be, should all have at least a fundamental understanding of health economics to help their practice?
Yes, absolutely. Yeah, because as now we have the limited resources, and as we can see in this changing world, so we have the healthcare budgets there and not increasing compared with the other areas. So in this context, and to improve the patient care, and it is really useful, for the healthcare professionals to know about the health economics. They don't need to know about the how to do cost effectiveness analysis, but at least they should know the principle, right? So they should think about, okay, if we compare X versus Y, so what is their outcome look like? And what would happen, or what does it mean in the long term? So for example, in this context, healing rate, so which was the crucial factor.
I'm hoping now, Vijay, that everybody that's listening to World Without Skin Tears Day is rapidly Googling health economic courses and they all want to do one. But listen to what you said, Vijay, and listen to Ray and Kim. You've been talking about prevention, management, and, trying to highlight that this is not just a skin tear and that cost does matter. But Kim, you're very clinically based over in Canada, and you see your patients a lot. How do you think clinical practitioners could build a compelling case for choosing this higher priced products? Because we've talked about, we know why we should. Everybody on this call now knows why they should, and they're all going doing health economics. But when you go back into your clinical areas, how do you think you can support the practitioners?
Well, for me, what I often do is I come in with I bring the literature with me. And now we have another piece to that I can bring in. So what we normally do is we build a financial case where we'll talk about what's said in the literature. We'll talk about how many skin tears a facility may have, and we'll talk about how long they're taking. We will go back and I'll look to see how long are they taking to actually heal those skin tears, because we track those things. And then we'll look at what type of dressings they're using, what kind of prevention program they have in place. Because if you have a skin tear, you're 80% more likely to develop a second skin tear. So you just because you have one skin tear actively doesn't mean you're not going to get another one while you still have that skin tear. So, we kind of lay that out for the managers and talk about the need to put in these preventative measures, but at the same time get the proper treatments in place. And normally, if you come at it from that approach where you've showed that you've done your homework, that this is what the literature says, this is how that translates into our practice. What are we actually seeing? So you have to do your statistics. You have to know how many skin tears you have or whatever wound you're looking at. What's your prevalence? What's your incidence? So that then you can go to the manager and say, look, this is the burden we're currently experiencing. This is how much we're currently spending, and this is what we're spending it on. If we follow the literature and we put in these measures, we have a potential cost savings of this. And I've been very successful in doing that. But you have to come in with the statistics. It can't, otherwise you need to have the proof. So to me, that's when, where we really work as a team. When I say work as a team, and the facilities tend to get very excited about it. Aged care homes, they get really excited when they start seeing the results happening. It's a harder sell in acute care because the turnover is so high. So it's a much harder sell in the acute care settings. And in the home care settings, it's also another challenge because healthcare professionals only get involved in a small fraction of the people who actually developed skin tears in the community. So, they're self-caring. So there's a whole other dynamic. And we could spend hours talking about some of the challenges that we face. But if we look at where a lot of skin tears do happen, which are in the aged care or long-term care facilities, it's a lot easier to make an impact there.
Thank you. I think it's exactly what you said about raising awareness, not just as Ray said with healthcare professionals, but with the general public, patients and carers, care homes, etc. But could I thank you all very much for all your insightful discussions. It's been really good. Thank you, Kim, Vijay and Ray. And for people listening, we started off talking about what skin tear was, why health economics was so important and cost. Vijay then walked us through the health economic modelling and demonstrated what cost savings could be had by actually just ensuring that you're using the correct dressing at the correct time and the reduction in visits as well. We've had a really good discussion as well about what are skin tears, they're not just a skin tear, and again about how health economics is really important for everybody. So we talk about holistic care, so we talk about prevention, management, treatment, evaluation. We should also be talking about cost effectiveness and value for money as well. So once again, thank you very much, Kim, Ray and Vijay, and we look forward to any questions you may have at the end of World Without Skin Tears Day.